Hi guys, we have a case of a 45-year-old male with abdominal pain. Let's go through the images. So in the portal venous phase, let's just come from top down. The lung basis looks okay. The heart and the pericardium looks okay. Going to the liver. So you see how the liver is low density or more darker than the spleen. So this is seen with hepatic steatosis. So this patient does have hepatic steatosis. There's a bunch of air. I don't know if it's interluminal or extraluminal. We'll look more carefully. But the thing that suddenly grabs my eyes is this all this fatty stranding around the pancreas. So this is something I talk about a lot. Is that anytime there's inflammation in the abdomen, one of the things we can expect to see is that there's inflammation, edema. So the fat would contain some element of fluid. So let's just look at normal fat around the kidneys here and around this pancreas there's just a lot of fatty stranding and there's some fluid here as well. So this would be consistent with acute pancreatitis. Let's scroll down more. I think there is a fluid collection here. Let's look in coronal. um, and here there's some fluid, but so let's just go. So this is your stomach. Come down more. This is your duodenum, the second part of the duodenum, the third part of the duodenum, and just above this third part of the duodenum right here there is a fluid collection, and people can have fluid collection associated with pancreatitis. So that's what we're seeing right here. And then there's fluid inflammation around the pancreas here. We have lung window. Let's just go to lung windows. Here we see a really good case of pneumatosis. So there's air outlining the rectum here, sigmoid colon here, and as I go more around the descending colon. So there's pneumatosis completely around the wall of the colon. Here's transverse colon, ascending colon here. There may be tiny locules of just like free air around, but mainly it's pneumatosis. And now then we have to answer, why does this person have pneumatosis? And I'm not so sure. Pneumatosis usually have a big differential. There are some benign causes, there's some bad causes. This person has pancreatitis and pneumatosis. Let's just look at the X-ray. And we do see pneumatosis. Let's go to the discussion. So benign pneumatosis of the entire colon, presumably due to pancreatitis. Okay, I did not know that pancreatitis could cause pneumatosis. Now I know too. And the other thing in any case of pancreatitis that we should look at is how is the gallbladder, because you can have biliary pancreatitis from gallstones. So the gallbladder wall is pretty nice and sharp. I don't see inflammatory fatty stranding around the gallbladder to tell that there's cholecystitis. I'm not able to window and level, and CT is not super sensitive for gallstones, but I do not see any gallstones in the gallbladder when I quickly look through it. And then I like to follow the biliary ducts to see if they're abnormally dilated, and here I can see a little bit of common bile duct. It's at least normal in caliber. So again, not the best sensitive. We would want to do MRCP if you are concerned about common bile duct stone, but within the limits of the CT, neither do I see stones in the gallbladder or the common bile duct. So this is a case of pancreatitis, and the fluid collection around the pancreas in pancreatitis, it depends how long it has stayed and whether the pancreatitis was a necrotic pancreatitis or non-necrotic pancreatitis. I don't know how long this patient have had abdominal pain, because that could tell us. This is a quick guide in the radiology assistant. Let me just briefly find it. Liver acute pancreatitis. So for acute pancreatitis, just a second, they had a chart that would tell how to classify the collections around pancreatitis. I'm just trying to find it Okay, right here. So after acute pancreatitis, if it's a non-necrotic or interstitial pancreatitis, then if it's the fluid collection has lasted for less than 4 weeks, then we call it acute peripancreatic collection. If it's more than 4 weeks in a non-necrotic or interstitial pancreatitis, we call it a pseudocyst. In case of necrotizing pancreatitis, if it's less than 4 weeks, then we call it acute necrotic collection. If it's more than 4 weeks, then we call it Waldorf necrosis. So I'm not so sure the history in our case, but that's just the way that we classify the fluid collections. Thank you for watching the video.